Okay, we're going to go ahead and get started. So I'm Samantha Carlson. I was an HTC social worker for about 10 years, and now I'm the Area Agency on Aging Director here in Kalamazoo County. And today we're going to talk about aging and blood disorders and how to do so well. I have no conflicts to disclose, so we'll go ahead and get started. If I can move my slides, excuse me. There we go. So aging well with blood disorders, what does that look like? This diagram on your screen is what a social worker is kind of going through and thinking about when you go to your HTC, when you go to your comprehensive clinic. We're evaluating what your physical condition is, what brings you into the clinic that day, how you're doing with your blood disorder and any other medical conditions you might have, as well as emotionally how that's impacting you and your family, and looking at the social environmental impact. So if you have a bleed, does that mean that you can't go to work? If you are caring for a loved one and they have a bleed, what does that mean for you as a caregiver? So aging well, what does that mean and look like? We're really excited to be able to talk about that with the blood disorder community because that was not always the case. 50 years ago, our blood disorder patients were not living a long, healthy life because of what we've been able to do with treatment and prevention. So when we're talking about quality of life, we're talking about physical wellness, mental wellness, spiritual wellness, and emotional wellness. And when you look at this diagram, we're talking about what that means for your economic situation, what that financial impact is when we're aging longer than we expected to. Physically, what that means on your body, if it means complications with arthritis or joint issues, etc. That physical environment that you live in, if we have to make modifications and talk to a physical therapist, like we'll talk with Sherry later, about what might be good preventive information to consider putting in your home, as well as the social services and community resources that I'll talk about in a little bit. Aging and blood disorders, again, this is a new era for us with the bleeding disorder community. We're looking at what that looks like from many different levels. And as a social worker, I'd love to tell you about a couple of my patients. So we had two gentlemen in our clinic, two of my favorite patients, although all of them were my favorites, that came in and they had another brother that had died from his complications from hemophilia. And these gentlemen were in their 50s and they said they lived hard and loved it. So they were partying and they were drinking and they were living as if they weren't going to die. And this is my favorite quote actually on this next slide. We were living like we were dying, but we lived. And they were talking about they didn't have the planning in place financially. Both of them were working as kind of handyman type work in their neighborhood. And that evolved into a business that they created because they were able to stabilize their blood disorder and live a very well and meaningful life with their families. One of the gentlemen, he is in his 50s. He was on a roof doing some repairs. And when he was going up onto the roof, he fell off the ladder. He said he guessed he just didn't think that he was an 18-year-old anymore. He was acting like he was, but he was aging and his joints were really starting to freeze up on him, especially during specific kinds of times during the day. And unfortunately, because of the fall, he had a massive brain bleed because of his bleeding disorder, and he was in the hospital for quite some time. And when he came out of the hospital, we talked about what a scare that was for him and his family and how he needed to do some planning for his aging. What did that look like with changing his profession? How could he transition into being more of a foreman and not doing the roof work, even though he liked still thinking he was a teenager? But also financially, what did that mean for their family without having income coming in because he was unable to work because of that bleed? So it triggered a really great discussion about aging and kind of the infrastructure of aging well and what that looked like for him and his family. And he really got excited because it gave him back some control. He really felt anxious and angry and fearful that he wasn't going to be able to provide for his family as he aged. And he kind of talked his brother into having the same conversation with me later on in the clinic. Another family I'd like to talk about was another family with multiple issues in medical genetics throughout their entire family, but they had two uncles with hemophilia who had many disorders and disabilities because of the bleeds they had in their joints. Both were wheelchair bound. They were living together in a home that they owned, but they could no longer keep the upkeep. They were having issues with snow removal. The house was starting to get dilapidated. And the brothers were very insistent on providing for themselves. And the family really struggled with trying to help them go in and do snow removal when they could, but they also had their own obligations. So as the social worker for that family, the conversation we had were, what are those resources in the community that they were willing to engage in? Once again, we're talking about having that lack of control, but then realizing what those tools are and what you're eligible for in your community so we can make sure you age safely. So we're going to talk about area agencies on aging today. What is an area agency on aging? So it is a nonprofit organization. They are across the country. We have 629 of them in the United States. They are federally funded through the Administration of Community Living through the Older Americans Act of 1965. The money goes to the state, and then the state funds the area agencies on aging in the region. Ours is the Kalamazoo County Health and Community Services Area Agency on Aging. We're Region 3A. I will go ahead and put the link in the chat later on in our talk so that you have access to seeing where the Area Agency on Aging is, where you live or a loved one lives, if you decide you want to access these services. But you can also talk to the HTC social worker. She'll be happy, or he will be happy to provide that information to you. So what do they do? So an Area Agency on Aging does several different things. Advocacy and outreach is one of the main things that we work with when we're talking about going into the community and making sure people know how to age well and age safely. We know that a lot of older adults in Michigan live in long-term care facilities, and that can be described as a nursing home, adult foster care, assisted living, or home for the aged. A long-term care ombudsman is an advocate, or usually a social worker or a nurse, who can go into those facilities and advocate for older adults. We've seen with the pandemic that many of our residents that are living in those facilities were not able to see their family members and had questions or concerns, and the ombudsman were able to link them to the resources that they needed and to advocate for them to make sure that they had patient-centered care, that their wishes were being carried out and abided by throughout the restrictions with the pandemic. Outreach and speaking engagements, this is a perfect example of one. We like to tell people about our sources or resources so that we can be a source of support for you and your families as you age in our community. Education on abuse, neglect, exploitation is really important to talk about with older adults. We see it's a little different than with kids with abuse in the fact that a lot of financial abuse happens more so than physical or neglect. So financial abuse is exploiting an individual financially, using their credit cards, conning them, scamming them. And we've seen a lot of that in the recent months, unfortunately. And making sure we're working with our community partners to educate folks on prevention and make sure that folks don't fall for financial scams. Neglect for older adults can be very devastating. Someone can self-neglect, meaning they don't take care of themselves, and they might be sick enough that they don't realize that they could lead to their own death by neglecting themselves, or neglect of a caregiver who agrees to provide that care but chooses not to or does so in a harmful way. So we do a lot of advocacy and resources about that. Information and assistance is something that every single area agency on aging in the country provides. It's a social worker on the other end of a phone, free of charge, that you can call anytime about what resources there are in your community. They are specialists in the aging population. They know what those resources are for our community, and they can link you to assistance as needed. Finally, we have something called Aging at Home services that we provide. We work on an assessment, so a social worker or a nurse would do an assessment to see what the individual would qualify for and what their goals and wishes are. Not everyone wants to go to a long-term care facility, and if they're able to stay at home, most people want to age at home. So an area agency on aging will send in support and resources for caregivers or individuals, older adults, living at home to do so safely. They do the assessment and they evaluate homemaking issues, personal care item issues, home repair needs. Meals on Wheels is an option that they might refer if the individual's having a hard time getting around the kitchen safely. And then there's also something called a PERS button. That's a personal emergency response button. And on this slide, it's listed as a PERS. That's the fallen and can't get up button. It can be a necklace or a watch, but many of our older adults have decided to use that, especially with COVID. They don't want people coming into their homes, but we've been concerned on if they fall, who's going to help them. So they use that button to make sure that 911 can come and help them safely. Finally, we also have some community resources that we love to talk about. Prevention's an amazing thing for the aging population. We have PATH, which is a personal action towards health program, where a social worker has a conversation with older adults about how to age well, what resources are out there, how do we keep our brain healthy, how do we keep our body healthy, and how do we keep our emotions healthy. So it's kind of a support group of older adults who really want to invest in their health. Matter of Balance is a fall prevention class, which we'll be hearing about a little bit later, some of the fall prevention techniques. But their goal is, if you do fall, how do you do so safely? And what are those resources that you can use in your home and your community to make sure that if you do fall, it's the least possible danger to you and your family? And then Creating Confident Caregivers, CCC, is a class that we have for individuals that are caring for an adult with dementia. Caregiving is really hard, and dementia is a very difficult disease, and we want to make sure that we're supporting caregivers in our community so that they can be emotionally safe and ready to take care of that individual. So during that class, we send out respite workers or a licensed healthcare worker to come and sit with the individual with dementia while the caregiver comes to the class, or we will go ahead and send them to adult daycare while the caregiver is able to attend the class. The last program I'll talk about is MAP. It is a organization that is through the state. It's throughout the state of Michigan, and it's a federal program. So if you're in a different state, they do have that program. It's called Something Different. And this is where we have the opportunity for someone to review your insurance with you and help you make pick the best option for you and your healthcare needs. So a lot of folks have issues with Medicare, trying to figure out which one's the right plan for them. This is a free service that's unbiased that can help with that service. You'll see on this slide, there's a couple other listed resources through area agencies on aging. We're all a little bit different throughout the country, but the home delivered meals or Meals on Wheels are funded throughout the country. That's a great opportunity for older adults that are really struggling to prepare meals every single day for themselves. Like I said in the discussion with the older adults I was talking about from my previous caseload, the two uncles, they decided to have Meals on Wheels 3 times a week so that they had opportunity to have a hot meal that they didn't have to prepare, but they were still able to get in the kitchen and cook when they did want to. So it was a good compromise for them for some kitchen safety. And then again, the adult day services and respite that we talked about as well. The takeaway from my perspective, both as a social worker that worked in hemophilia and as a bleeding disorder social worker, as well as the takeaways from the Area Agency on Aging, is we're all aging and we all want to do so well and have a good quality of life. For instance, we have choices like I had to make the choices to get bifocals this past week, and I love them. I can't believe I pushed it off for so long. Because I'm in my mid-40s, I thought it was making me old, but I realized that tool made me a lot safer and made me a lot stronger when it comes to wearing my glasses and making choices. So with that, I'm going to go ahead and hand it to my colleague, Sherry. She's going to talk about fall prevention.
Thanks, Samantha. That was very interesting and really nice to see those resources in place. It is really exciting, as you mentioned, to be able to be thinking about moving into a time where people with bleeding disorders are aging. I'm going to take it from here and talk about one of the less graceful aspects of aging, and that's falling. And this is important for all of us because all of us are at risk of falling, and we need to prepare ourselves the best way that we can to prevent it and to deal with it if it happens. I don't have any disclosures or conflicts of interest, but I do want to mention that this talk is a general overview about fall risk and prevention. There are very sophisticated programs for teaching people about fall risk and prevention. As Samantha mentioned, some of the fall prevention programs, and there are also specialists, physical therapy specialists and other healthcare provider specialists that are experts regarding falls. That isn't my area of expertise, and this doesn't replace the need for an individual assessment with someone if you have a risk of falling. So I'm going to share some scary numbers with you first, and then we'll go on to talk more optimistically. But the CDC tells us that every second of every day, someone over the age of 65 falls, and 1 in 4 people over 65 will fall every year. 3 million are treated in emergency rooms, and 1 in 5 results in an injury like a broken bone or a head injury. And I want to mention that these injuries are not specific to people with bleeding disorders. This is the general population that's experiencing these injuries. So if you have a bleeding disorder where a fall might cause more complicated injury because of risk of bleeding, that's not taken into consideration here. Falls are the #1 cause of injury-related death over the age of 65. So this isn't trivial, even though here we're talking about people over 65, that's because that's where the data is, but people under 65 are falling too. And as we're aging, the systems that our bodies have in place to help protect us from falling are beginning to decline gradually. It's not like it's a magic number that hits when you're 65. So I just don't want all of you who are not 65 yet to dismiss what we're talking about based on this data. It's relevant to all of us. My experience is that we tend not to think about falling until we fall. You know, we learn to walk when we're young, and after about the age of 3, walking is what we call subcortical. We don't have to think about it. We can walk and we can sightsee, we can walk and talk to friends or our spouse, we can walk and eat ice cream. We can not have to concentrate on the fact that we're walking until something happens to one of our joints or to a muscle or something that disrupts that automatic ability to walk. And sometimes, you know, something goes wrong. So I'm going to bare my soul here and tell you a cautionary tale of my own fall experience. It's embarrassing. You know, we tend to be embarrassed when we fall because it makes us look vulnerable or something. But I want to share this as an example of what can happen even to the best of us. So I was leaving work in the afternoon on a very beautiful fall day. It looked a lot like this. The sky was brilliant blue. I remember the day actually like it was yesterday. And I don't know if that's because of the trauma of falling or because of the fact that it was just that beautiful of a day. But I was walking along. I had my work bag over my shoulder, carrying my computer and some other things. It was quite heavy. And I had my jacket over my other arm because it was so warm. And I was walking along, just enjoying the beauty of the day. And then the next thing I knew, I was falling, and I was already falling so far that there was no ability for me to catch myself. I went down on the sidewalk and really had no idea what had happened at first. My ankle was sore, and I will admit I was mortified because I was sitting on the sidewalk and there were cars going by me. I was on kind of a busy street and cars were going by me and I couldn't get up quick enough. But as I was thinking about getting up, I was also thinking about, I need to figure out why I fell because that was bizarre and dramatic and I have no idea what happened. So I started looking around and the sidewalk was smooth and nothing really seemed out of the ordinary until I realized that there was a walnut right where I had stepped. And I believe that I stepped on top of the walnut and my ankle twisted, which is why maybe it was sore, and I went down without any ability to catch myself. I was wearing some shoes that were a clog style shoe with a platform that on level surface is very stable, but certainly not intended for walking on surfaces where I might encounter a walnut. It was really an eye-opening experience for me when this happened. When you fall like this, when you're asked on a fall screening about history of falls, this raises a red flag. What raises a red flag even more is if you have had more than one fall. And I am going to disclose myself even further and tell you that within the same year I had a second fall. And this one happened when I was leaving my home to go to work, carrying the same bag over my shoulder. I had on my winter coat and my winter boots, and I had a cup of coffee in the other hand. You would think I would have learned that I shouldn't have both hands occupied, but I did once again. And I was walking out to my car. It was winter. I checked for snow and ice. Everything was clear. I'm very cautious in that way, but I was walking around behind my car, and next thing I knew, I was on the ground. I didn't even know I was falling that time until I hit the pavement. And that was related to some black ice that was at the back of my car. And in that case, I wasn't seriously injured, but I did end up with bruising on my hip and bruising on my shoulder, and it took me several days to sort of not feel sore from that fall. I was really fortunate that I didn't hit my head, that I didn't break any bones. But I thought a lot about the fact that in the case of both of those falls, the first one where I hurt my ankle and the second one where I hurt my hip and my shoulder, that if I had a bleeding disorder, this might have had a much more serious outcome. And certainly it would have been a case where I would have been calling my treatment center to discuss what I needed to do about factor. Fortunately, in neither case did I hit my head, which I want to emphasize that if you fall and hit your head, that's a medical emergency and needs to be dealt with right away. So why don't we fall? Let's talk about that for a second before we move on and talk about why we do. Our body is very sophisticated in keeping us upright against gravity. From the time we're young, unless we have a barrier, we move in that direction. And for most of our lives, we're able to stay upright without thinking much about it. We may face challenges along the way that our bodies can adjust to. And as we age, our ability to adjust to those, we call them perturbations or things that might push us off balance, our ability to respond to those changes. But we start out with this highly complex cooperation between the systems, our vision, our vestibular system, our somatosensory system, which is the system of tactile touch, and our proprioception. I do want to take a minute to explain proprioception because that's not a sense we talk about a lot, but that is your body's awareness, or your brain and body's awareness of where your body is in space. So when you go up a flight of stairs and you know exactly where to place your foot without thinking about it, you don't have to look, that's your proprioception working. Or if you were to close your eyes and I was to move your right hand around while your eyes closed and position it in such a way that you could copy with your left, the fact that you can copy that with your left hand without seeing is your proprioception working. So that plays a part in our balance. Our strength, range of motion, and flexibility and muscle tone play into our ability to stay upright. And our balance and protective reactions are there if we do go off of our base of support or lose our stability. Our righting reactions will help us come back to the middle if the push off of our balance is not very big. If it's bigger, then we might stagger, put a foot out to try to prevent ourselves from falling. But if we are pushed off of our base of support or fall off of our base of support, then our hands generally will go out to protect us. And if we fall all the way down, at very least, our body's trying to keep our head from hitting the ground. Sometimes it works effectively and sometimes it doesn't. The last thing on here is cognition and attention, and it probably should be at the top of the list based on what my fall expert friends have been telling me about what's being learned about falls. There's a lot of conversation about why many of us trip, but not everyone falls. And cognition and attention and executive functioning seem to play a big part of that. I would say that in my fall, attention probably was a big part of why I fell, because I didn't pay attention to the fact that there was an acorn on the ground. With the ice, maybe I would have seen it, maybe I wouldn't have. I was paying more attention there, but the fact is that I wasn't attending completely to the situation. Lack of attention is at the top of this list about why we do fall. So lack of attention or distraction. I was definitely distracted. I was fully enjoying what was going on around me, and I was not paying attention to where my feet were going. Was my executive function in decline? Well, you know, I'm in my late 50s now, and it's possible that my cognition and executive function are declining, but I don't notice that on a day-to-day basis other than, you know, occasionally forgetting something or realizing that I'm more easily distracted than I used to be. But I think we should pay attention to the fact that our cognition and executive function may be changing in gradual ways, as well as, unfortunately, in some cases that are more extreme. We can experience side effects from medications or interactions between medications that can increase our risk of falling. On that day, I don't take medications, so that didn't impact me, but it's a very common impact on falls because many people are taking medications for pain or medications for blood pressure or just medications that may interact and influence some aspect of the risk of fall. You can fall because of a drop in blood pressure. You can stand up too quickly and become dizzy and fall down for that reason. Also, you could fall because you're afraid of falling. And that's not a direct cause, but if you're afraid of falling and you stop moving around, you become less active because of that fear, then all of the things that you require physically to stay healthy and be able to stay upright start to deteriorate even more. These are physical things that can increase the risk of falling. So being tired, having fatigue, having muscle weakness or loss of strength, which can happen if you have a bleeding disorder that's affected your muscles or your joints. Having pain can increase our risk of falling, and this is common in people with bleeding disorders as well as just people who are aging with osteoarthritis or other chronic conditions. You can fall because of a loss of flexibility or loss of range of motion. If you think about when you're standing and you need to have your feet flat on the ground, if your ankle range of motion doesn't allow you to have your feet flat on the ground, then your base of support is not as stable, and you can lose your balance and fall as a result of that. You can fall because of loss of sensation, like people experience with a myopathy or with diabetes. It's a common complication to not be able to feel your feet as well. A loss of proprioception that we talked about, which can happen as we age, but also happens when we have joint damage. It reduces the ability of our ankles and knees to transmit information to our brain about where our body is in space. And if you're unsteady or have impaired balance of your vestibular system, that can also contribute to falling. If we look at physical things not of the body, but external physical things, uneven surfaces and unstable surfaces can trigger a fall. Obstacles like tripping over a box that you didn't know was there, hazards like cords and rugs, slippery surfaces, like in my case with the ice, colliding with something can cause a fall. Poor lighting can cause you to not see something and fall. Frankly, almost anything can trigger a fall. So what can we do about it? Well, the first thing is think about it and make a plan. Talk to your primary care doctor or your hemophilia treatment center team. Reach out for some of the resources like Samantha talked about, where you can attend a fall prevention class or get screening for yourself about what your risk of falling. And definitely tell your physician or your treatment center right away if you have fallen or you're afraid of falling or you feel unsteady. Don't hide that. It's easy to want to hide it. Honestly, both times I fell, I did not want to tell anybody that it happened. But the fact is that paying attention to the fact that it happened and trying to understand the reason why and prevent it from happening again, is really important, because in my case, I didn't have a serious injury, but I could have fractured a hip or I could have hit my head. And I want to prevent that if I should fall again in the future. It's good to monitor your blood pressure, know if you have fluctuations. If you're lying down and you're going to stand up, sit at the edge of the bed for a few minutes and let your blood pressure normalize before you stand up so that you don't experience dizziness. Go over medications with a pharmacist and make sure that you don't have medications that are likely to cause you to have a risk of fall, or if you do, at least understand that so you can make precautions knowing that. Have your eyes checked every year and use appropriate glasses. Found it interesting that Samantha was mentioning wearing her bifocals, because actually bifocals and multifocal lenses have been associated with falling while walking because it can distort your vision. So I learned as I was preparing for this talk that there's something called walking glasses, which are a distance lens, single lens that you can have for walking that prevents the distortion that happens from bifocals and multifocals. But that's something to talk over with your ophthalmologist, your optometrist. I like to talk about wearing appropriate shoes, getting your feet checked. What are appropriate shoes? I'm not sharing that because it depends on what you're doing, but making sure that your shoes are appropriate for the situation, that they're secure, and that they're comfortable and fit well. Improperly fitting shoes are associated with falling. And as a physical therapist, I have to highlight, of course, staying active, which is much easier said than done, particularly if you're afraid of walking, afraid of falling. It can be difficult. But I highly encourage you to try to find a way to stay active. Talk to your treatment center PT. Consider the fact that it doesn't have to be a formal exercise program or a sport participation or anything like that. Staying active can mean, how many times you go to the refrigerator to get something out when you're baking, or how many times you walk around the bed when you're going to make the bed. Stay on your feet safely as much as you can. It can prevent decline in many of the systems we talked about, like loss of flexibility and loss of strength, loss of balance, loss of proprioception. All of those things can be improved on by staying active. So here are some practical things that you can do inside the house. These are kind of common sense things. You've probably heard them before, but I'm going to go ahead and go through them because I think they are important. Remove throw rugs. You may think that it's been there forever and you're never going to trip over it, and the next thing you know, you're tripping over it. Keep your rooms, floors, and stairs free of clutter. That is not easy to do, particularly though, be careful about the stairs. Putting something that you're going to carry up the next time you go or carry down the next time you go is an accident waiting to happen. And I'm really concerned about the possibility of somebody tripping over something on the stairs and ending up at the bottom. Position furniture in your home with room for moving around it. You don't want to catch your foot on a table leg or your cane if you're using one on a table leg. Move electrical cords out of your walking path. They're notorious for tripping people up. Position items that you need to reach in a convenient spot for reaching. So maybe not all the way on the floor, maybe halfway between your knee and your hip so that you don't have to bend down as far to get it. Things that would be up high, bring them lower so you don't have to stand on a stool or climb up to get it. Install handrails, if possible, in the bathroom or on the stairs. Both sides of the stairs is ideal. Tack down edges of carpet and ensure good lighting. And obviously there's work involved with doing some of these things, and you may not be able to do them yourself, but it may be things that you can enlist help from some of the agencies that Samantha talked about or family members. But it's important to do a survey of your home and look for the things that might be risky for you. When you're going outside, what can you do? Well, think about where you're going. Think about what kind of surface you're going to be walking on. Is it going to be sand or grass or uneven or level? Are you going to be getting in and out of a car, going up and down stairs? Are you going to be out for a long time? Do you have the endurance for the distances that you're going to be walking? Do you have access to a bathroom without having to rush? ask yourself these questions and plan ahead a little bit. Keep your hands free. That was my mistake both times. My hands were not there to protect me when I fell either time. A small shoulder bag or a small backpack are a good idea to keep your hands free. And don't walk with your hands in your pockets. That can be a disaster, because if your hands are in your pockets and you go down, there's absolutely nothing that your body can do from a protective reaction standpoint. Keep stairs and entryways clear and in good repair with good lighting and a handrail if possible. If you're going in or out, let your eyes adjust to the light or darkness so you don't misstep, walk into an obstacle that you don't see is there, hit a crack in the sidewalk, any of those barriers that are obstacles or hazards that might be in your way. If you need an assistive device, use one. People tend to be embarrassed or self-conscious about using a cane or a walker or a walking stick, but it's been shown that just having something like that tactily to touch reduces the risk of falling. That, or putting your hand on someone that you're walking with and getting that sensory input from them. Please don't let your self-consciousness about using an assistive device keep you from being mobile. Having a device, knowing how to use it properly, can keep you active. And I'm very concerned about people deciding not to be active because they don't want to use a device out of embarrassment. Always carry a cell phone if you're able, or at least let someone know where you're going if you're leaving alone and walking alone. You don't want to be stuck somewhere on the ground, not able to get the help that you need. So there are things that we cannot change about our fall risk. We can't change age or fall history or chronic conditions or the fact that we have poor sensation or poor vision or loss of memory. But there are a lot of things that we can change. We're not helpless in this situation. We can do things to improve our muscle strength. We can improve our deconditioning. We can wear glasses to correct our vision and turn on more lights or use night lights. We can plan for a situation regarding urinary urgency. Some people are dealing with this on a daily basis and you have to rush to the bathroom. There are strategies to put in place so that you don't have to do that and increase your risk of falling over that. Use devices or ask for help. Remove trip hazards. We can fix uneven surfaces. We can add rails to our stairs and stay off ladders and stay off step stools. We can raise seats so it's not so hard to get up. We can use grab bars. We can avoid slippery and wet surfaces as much as we're able to envision them. So we have things we can do. We aren't victims to all of those things. We can change some. So how do we know if we're at risk of falling? There are some self-screens and checklists. I didn't choose any particular ones to show you here, but there are self-screens that you can find online, or you can ask for them through your primary care doctor. You can also get professional screening. You can see a physical therapist who specializes in falls, or go to a fall prevention program, see a physical medicine doctor who is experienced with falls. But it is really, really important to understand your own risk, assess your own individual risk, and develop a plan individually for how to reduce that risk. So let's consider your status here for a minute. Do you have joint disease? Do you feel unsteady when you walk? When you're getting out of a chair, do you have to use your hands to get up? Do you have trouble stepping up a curb? Have you fallen down in the last year? Are you afraid of falling? Do you limit your activity to prevent falling? Do you often have to hurry to the bathroom? If you answered yes to these, I would suggest that it's time to talk to someone about fall risk. And honestly, even if you didn't answer yes to any of these, I still think it's good to talk to someone about fall risk, because all of us are aging and all of us are at risk. If you do fall, what can you do? Well, I encourage you to try to make sure you have access to a phone. Now that phones are not hung up high on the wall, it's easier maybe to have them on your body or strategically placed where you could reach them if you end up on the floor. Consider an emergency call system. Samantha talked about that. There's the buttons that you can push to get someone to come. I also learned that some of the smartwatches now have the ability to detect your change in elevation when you go from standing to falling, and they alert, the phone calls you and asks you if you've fallen and asks you if you need help. I imagine those are quite expensive resources, but I thought that was kind of a cool option for people who do have a smartwatch. If you have fallen, decide if and how you should get up. You need to determine if you're injured, or if you're with someone who falls, you need to determine if they're injured and not try to help them get up if they're injured. call 911. The fire department is very used to coming and helping people get up when they fall. It's a common thing that they do. If you fall and experience a head injury, that is a medical emergency and you need to get attention right away. If you are able to get up, I encourage you to crawl to a stable surface, maybe on hands and knees or scoot on your bottom and slide up onto the surface, sit for a few minutes before you get up to standing. Given my own experience, I know that it can be very unsettling to fall, and you probably don't want to get up and start moving around really quickly. Make sure you take your time. And of course, implement your factor management plan, contact your hemophilia treatment center. If you fell like I fell, you need an infusion if you have an infusion plan. If you have a severe bleeding disorder that you infuse for trauma, both of my falls were trauma. They both would have required me to be infused, but definitely be in touch with your treatment center about how you should handle it. Just some reflections. We're all aging, we're all at risk. Some complications of bleeding disorders can add to that risk. In severe bleeding disorders, prophylaxis as prescribed can help maintain joint health and reduce the damage that leads to falls. And also, if you do fall, being on your prophylaxis according to your doctor's recommendation can help prevent bleeding that happens because of that trauma. I'm optimistic because there are things that we can modify, and staying active, which is within our control, is one way to reduce risk. Just a final thought, face the risks, use your resources, and make a plan. I want you to have the quality of life that you deserve as you're aging. I want to have the quality of life that I deserve as I'm aging, and I don't want to fall to disrupt that. So stay active, be healthy, and enjoy your aging life. We're going to move on to a live discussion in a few minutes, and we'll be able to take your questions. So hang in there and talk to us in a sec.